I just want to talk about the cancer recovery package very briefly, because this is something, again, that's been developed by the National Cancer Survivorship Initiative, and its sole aim is to improve cancer survivorship statistics. So it's to improve the lives of our patients who have had cancer in the past. It's interesting that there's an NHS England target that all patients who are diagnosed with cancer should be offered the full cancer recovery package by 2020. Though as yet we've not seen a funding stream to help support that implementation. There's lots and lots of information in the Consequences of Cancer Toolkit, which we've talked about already this afternoon, so I'm not going to labour the points too much other than to recommend you have a good read of the cancer recovery package info in the toolkit. But essentially there are 4 parts to this cancer recovery package. There's the cancer care review, there's the holistic needs assessment, then there's a treatment summary, and finally there are these health and well-being events. So just to run very briefly through what each of these 4 parts mean. The cancer care review you will all be familiar with. You know that our QOF ambition is to offer a cancer care review within 6 months of diagnosis to all our patients who have a new diagnosis of cancer. But actually the ambition or the aspiration is that those patients then go on to have an annual cancer care review, rather like a long-term condition review. So rather like the COPD patients have an annual review or the asthma patients. And the aim of this annual review is really to signpost and support patients to promote their self-management, to improve their healthy living choices, to really, give all that prevention information that we talked about earlier today. And also to review any other ongoing needs they may have, ask them if anything new has developed. And there's a useful Keep It Simple summary on page 75 of your books that will help you to do an effective cancer care review. Part of being an effective cancer care review may well be implementing this holistic needs assessment. And this is certainly something that's not as widely used. Indeed, many people may not have heard of the holistic needs assessment, but it's a really useful tool. So this essentially works as a pre-care review questionnaire. So when you invite patients in for their cancer care review, it's entirely reasonable to include a holistic needs assessment with their paperwork, ask them to tick the boxes and either drop it into the surgery or bring it into them when they come for their care review. And it really looks at all the different parts that cancer survivors may be suffering from. So the physical or emotional concerns, any practical concerns or financial concerns that they may have. And actually, if you've looked at their holistic needs assessment beforehand, it will really help you to structure the care review so that the patient gets as much out of it as possible. Now, these are easily downloadable. This one's just come from the Macmillan site. Again, the link is in your book, so it's something just to consider if you are going to improve the way that you do your care review process in the surgery. Perhaps including an HNA in that may be a really useful thing. The treatment summary, well, that's a bit like Ronseal. It does exactly what it says on the tin. That is a summary that ought to come from secondary care, back down to us in primary care, really detailing the diagnosis, the treatment, the prognosis, any ongoing care plans that secondary care have. And it's a means of increasing the communication between primary and secondary care, because we know that often there's a bit of a disconnect between the liaison between us and our secondary care colleagues. So really this is to try and improve that. Finally, the health and well-being events, and these you may well not have been involved with, but hopefully you will have heard more about. They're often run by Macmillan, and Macmillan have got a huge network of wellbeing events throughout the UK. They're normally run by multidisciplinary professionals, so you may have volunteers, you may have cancer survivors, you'll have physios, OTs, cancer workers, lots of different people attending these health and wellbeing events. And the idea is to offer group events whereby patients get support, they get information, they get an opportunity to ask questions, they just get that level of support in the community which many patients feel they lack because they get discharged from secondary care. So if you're not aware of what goes on in your local area, I would really recommend you find out, because then you'll be able to inform your patients as to where they can go for some additional support. NHS England aims to offer this cancer recovery package to everybody by 2020. And we should be trying to do these cancer care reviews on an annual basis going forwards, although I will be the first to admit that having some funding for that would be really helpful. The holistic needs assessment, however, is a tool which I think would be very easy to implement, and that's certainly what we're trying to do in our practice, to help identify problems with cancer survivors that they might well not otherwise tell you about. Gives them an opportunity to just, structure that care review so that they get the most out of it as possible. And there are lots of quality improvement ideas in your book sort of talking about the cancer recovery package, so please do have a look at that and see whether or not any of that is applicable to your personal practices.